Hello, I'm Gogo, and today we're going to talk about CKD and hormone drugs. In the treatment of kidney disease, hormone drugs, which typically refer to glucocorticoids such as prednisone and methylprednisolone, are commonly utilized. These drugs are widely recognized for their effectiveness in combating inflammation and suppressing the immune response in clinical settings. However, it's essential to note that they also come with a range of potential side effects. Given the connection of immune and inflammatory factors with a range of renal diseases, including nephrotic syndrome, IgA nephropathy, and membranous nephropathy, glucocorticoids find application in clinical interventions. This is primarily owing to their ability to act as diuretics and promote the elimination of urinary proteins, making them valuable for treating these conditions. Gogo's reminder: hormonal treatments are not administered casually, and their effectiveness is not guaranteed. It's crucial to understand that the assessment of benefits and risks should be entrusted to a medical professional. It's advisable to maintain a relatively consistent daily dosage of hormones, ideally taken around 7 to 8 o'clock during breakfast. This timing can contribute to safeguarding the gastric mucosa and minimizing gastrointestinal irritation. This specific time frame aligns with the body's peak secretion of endogenous glucocorticoids, which can help mitigate potential side effects of the medication. It's important to refrain from independently discontinuing, reducing, or altering medication during the hormone treatment regimen. This precaution serves two purposes: firstly, to prevent disease rebound, and secondly, to avert the possibility of adrenal crisis, a condition that, in severe instances, could result in shock and even death. Side effects can vary in intensity, with some common examples encompassing pharmacologic Cushing's syndrome characterized by a full moon face, buffalo hump, and acne, steroid-induced diabetes, osteoporosis, gastrointestinal bleeding, cardiac arrhythmias, infections, and more. Embrace a healthy lifestyle by practicing balanced dietary habits and engaging in suitable aerobic exercises. It's crucial to diligently adhere to your physician's guidance, refraining from abruptly discontinuing medication or adjusting dosage without professional consultation. Prevent infections. Prolonged hormone use can weaken the body's immune response and heighten infection risk. Be cautious. Minimize visits to crowded areas. Receive influenza vaccinations. Prevent exposure to cold and overexertion, and steer clear of contact with individuals with confirmed viral infections. Adhere to the doctor's instructions for medication and prioritize regular follow-up, which holds utmost significance. Consistently monitor parameters such as blood cell count, blood pressure, blood sugar, and blood lipids to prevent overlooking or delaying the detection of any evolving conditions. Several medications should be administered in conjunction with hormones, particularly at higher doses, to counteract the potential adverse effects of glucocorticoids. For instance, consider employing stomach protective medications to mitigate the risk of gastrointestinal bleeding. Prevent osteoporosis by utilizing osteopondin and calcium tablets. And, if deemed necessary, utilize hypoglycemic drugs to prevent and manage hyperglycemia. By judiciously utilizing hormones, one can simultaneously treat the condition while mitigating the accompanying side effects attributed to their use. That's all for this issue. See you next time.